Former chairman of the Nigerian Medical Association Bayelsa State, Professor Israel Jeremiah there. And speaking of health, well, Nigeria in the last 3 years has made great strides to improve the nation's health security, especially in the management of the COVID-19 pandemic. Well, since the establishment of the Nigerian Center for Disease Control in 2018, the country has seen more investment in the health security of the nation, especially as it concerns the coronavirus. While the country has seen huge investments in the management of COVID-19 as well as other communicable diseases, experts say the country is still ill-prepared for the next epidemic.
And with the Marburg disease lurking around as well as other viruses, the question is, how prepared is Nigeria for the next epidemic or even pandemic? Amaka?
Well, to give us some answers, health experts Dr. Usman Abdulrahman, who is a consultant on infectious diseases, joins us now. Thank you so much, Dr. Abdulrahman, for being here. We definitely appreciate you. Well, we've seen billions of dollars thrown at COVID-19, not just here in Nigeria, but all across the globe. But we're concerned here in Nigeria, looking at some of the health experts like yourself who said, despite all the money was channeled towards one particular virus, but we're not prepared enough. Do you share that sentiment, or are you on the other side that says enough has been done?
Thank you. I'm on the side of the fact that enough has not been done. Enough has not been done. We still have more to do in the country. Even if you look at what we did during Ebola, the lesson learned, it was what helped us to be able to do well during COVID epidemic. So therefore, we still need to improve on so many things as far as
such as
epidemic preparation is concerned. One, we need to improve on our surveillance capacities. We need to improve on surveillance capacity. We need to make appropriate. We need to train people on surveillance across the country, across the states. If you look at it right now, you see that when you come to preparedness, you know that Lagos is at the topmost. And you find that so many states in the country are still lacking behind. There's the issue of surveillance in the country. That is part one. Another one is the laboratory, diagnostic laboratory. You know, when you are talking of especially all these emerging diseases, you need the special laboratories for them. There is laboratory that we call biosafety level 3. It's not just ordinary laboratories now, because they can really spread if you don't think here. So therefore, it's not ordinary lab that you need for you to test all these emerging diseases. So therefore, Nigeria still needs to do more. We call it molecular laboratories. Most of the states don't have right now.
No, but molecular laboratories, I remember during the pandemic, over 150, most of them owned by the government, although some we still have private investors in there, were established all across the country. Are you saying that they are no longer functioning?
That is something we need to find out. Most of them, I'm sure it is locked now. They are locked up now. So, you know, the way we practice in Nigeria is when there is epidemic, everybody will start rushing helter-skelter. What do we do? So therefore, we need to keep on reactivating some of these things we do, not just waiting for an epidemic to happen. Especially in the area of surveillance now, you need to keep training, especially make sure that the states knows what surveillances are, not just federal, not just at national level. The same thing at laboratory. For example, it's not the same test that you use. It's not the material you use to detect COVID that you need to use when you are talking of maggot disease, when you are talking of monkeypox. So it's a different thing entirely. So we can't say that we are very prepared. We have molecular lab doing COVID, therefore there's nothing else to do. For example, you need to buy the PCR that you also need to test some of these emerging diseases, because it's not the same thing that causes all the diseases.
Absolutely.
Yeah, Dr. Usman, I mean, one will be wondering where is the place of the Nigerian Medical Research Institute in Yaba in all of this?
Honestly, I think
they're supposed to be championing some of the researches into these new and emerging diseases.
Thank you very much for bringing this out. I think they are not doing enough. I agree with you. The Research Institute is not doing enough. If you look at it, you will still see that, yes, a lot was done during COVID, but we don't have data for it.
So now,
that's a new revelation.
but at the end of the day, the truth is, from Ebola to COVID-19 and even Marburg just knocking around the corner, looking at the fact that our neighbors, Ghana, have recorded even deaths to the virus. So it shows you that there is a chance that we might even have it in the country because we're not testing enough, going by what you say. But the place of surveillance, I ask you, Port Health Services, I know that they're scattered all across the country. Would you say they're doing enough really in terms of detecting the symptoms even before we know if truly these people are infected or not?
Yes, they might be doing their own part at the port head point, but surveillance is not just about entry into country with flight. We are talking of borders now. We are talking of borders. Are we doing enough surveillance at the border? For example, going between Ghana and Nigeria, you can come from Ghana to Nigeria by road. So we have porous borders. Do we have health officers at the borders, at the Badagry border, at all these borders, Niger border and all that? Do we have health team there, also doing the same testing there? So we should just focus on our airports and say, okay, we need to do more. Because you find out that some of these things are not just by people that fly. It's also occur people that trek within the borders because our borders are porous. We need to emphasize. I need to use this opportunity to emphasize that not just port health that is important. Even land borders are equally very important.
And I think another important thing that probably might be missing and which you can quickly tell us is the synergy between the various tiers of government.
Thank you.
There are, issues that can be managed locally from the local government level.
At the primary healthcare facility.
Yes, but we know, for more than 20 years now, primary healthcare system is really in the doldrums.
Yes, it's another issue. But however, the issue of epidemics is even beyond primary health care. We'll begin to move on to what we call a one health policy now, one health approach. What do I mean by one health approach? We will need to begin to look at human health, animal health, plant health, environmental health.
So basically more research, but the government will tell you paucity of funds is a major challenge. You speak about reagents and the PCRs that are needed for some of these tests. They'll tell you it's not cheap. So how do we eventually get it right with the little funds that the government is actually allocating when it concerns health-related issues in the country?
The issue of one health policy is not actually about funding. It's about bringing people together that are involved to discuss. For example, if I give you a issue of Lassa fever now, you see that Lassa fever is being transmitted by rats. And sometimes it's because the way people spread their foodstuffs. So if you want to eradicate Lassa fever right now, it's not just about human health. You need to start talking about Ministry of Agri to begin to get awareness, create awareness, advocacy about how Lassa fever is being spread. That is what One Health is all about. If you are talking of monkeypox now, because it's also been transmitted from animal to animal, you need to bring veterinarians.
Veterinarians.
Do you understand? So this is what One Health is all about. It's not just about funding. It's to bring about all the multi-sectorial stakeholders to look into this. It's more like integration of all the ministries that are involved, not just about NCDC now. Some of these epidemic preparedness need to integrate other sectors of the country. Thank you.
Thank you so very much, Dr. Usman Abdulrahman, consultant in infectious disease. We just hope that all the stakeholders, government,
Even
donors.
us as individuals as well.
Even the media,
we need
the
to.
media.
We
Even
all
the
need
media.
to.
Yeah,
A lot of people have been
media
with
is
us for over
needed
50
for
years.
awareness and advocacy.
Absolutely.
Absolutely. We'll continue to do that from our
Over
own
50
side. Yeah.
years, we're
Thanks
still
very much
backing
for
it.
coming on Newsnight.
Yeah.
Well, do stay with us here on the Rise News. We'll be back after this short break with all the rest of the day's news. Don't go away.